Hi, I'm Dr. Pachowiak, and I'm an interventional radiologist with IR Centers. I wanted to talk to you today about a condition called frozen shoulder. Frozen shoulder is a very debilitating condition. It is a severe inflammatory condition of the shoulder that usually comes on suddenly. It can be associated with trauma, but it can be spontaneous, and it can also be associated with certain inflammatory conditions, certain autoimmune conditions that patients might have. And it does happen to be more common in women and people over 40. So these people are very unhappy when they have this condition. There's an array of treatments available, but they're of limited utility. So there's NSAIDs, there's steroid injections, they can do manipulation under anesthesia, and they can also go in and break up the adhesions in the shoulder. With all of these available treatments, often it's not helping the patient. And so the patient is desperate for relief. The orthopedic surgeon is desperate, and they feel like there's nothing left to do. So we have a procedure that fits in really nicely to help these patients, and it's called adhesive capsulitis embolization. So what we're doing in adhesive capsulitis embolization is aiming to reduce the abnormal blood flow. By reducing the abnormal blood flow, we're reducing the inflammation and reducing the pain that's associated with adhesive capsulitis. During the embolization procedure, you'll be brought into our procedure room. This is done under moderate sedation. What we do is access the blood vessel in your wrist, and we put a small catheter up to the arteries in the shoulder. We'll do an angiogram to map out all those arteries, and we'll find the abnormal arteries that are supplying the inflammation in the shoulder. In each artery where we find abnormal blood vessels, we will embolize. The procedure takes about 45 minutes, and then you'll be in our recovery room for approximately 1 to 2 hours. And then you go home.